Hello and welcome to Insights Care. I am Pooja Shah, the editor at Insights Care. So today, in our edition, Preventive Health Starts on Your Plate, we are joined by Dr. Niru Mathur, the founder of Eat Well, Thrive Better, to talk about how simple everyday food choices can help prevent disease and support our long term health. So, Dr. Mathur, we are pleased to have you here today. Welcome once again.
Thank you so much for having me. And I'm really excited for today's discussion so that we can dive into how we can actually live longer with proper nutrition, not just a long life, but a better quality of life.
Great. So, to begin with, Dr. Mathur, could you please start by telling us about yourself and what was your inspiration behind to focus more on preventive health through nutrition, especially?
Yeah, sure, certainly. So, see, my background is actually in clinical dentistry. While practicing, I noticed a recurring pattern. Oral health issues were mostly almost always linked to systemic lifestyle diseases, things like inflammation, poor gut health, and metabolic imbalances. I realized I was treating the end result of poor health rather than focusing on the source. So, this realization made me pivot into nutrition and lifestyle coaching, where I wanted to help people stay out of the clinic by fixing what was actually on their plate, what they were actually eating.
Okay.
Yeah,
Okay, so only the little changes were made, everything was same.
yeah, mostly
Great.
same.
Okay. And what was your more main philosophy to start Eat Well, Thrive Better and how it supports preventive health through diet?
Okay, so see, my philosophy is anchored in the idea that food is medicine. We don't look at nutrition as a weight loss tool. That, of course, happens as a byproduct. We view it as a clinical intervention. By focusing on nutrient density and metabolic correction, we help the body to heal itself. We are happy to share that we have backed around 1,800 clients by teaching them how to use science based nutrition so that they can create an internal environment where such chronic diseases won't be able to thrive. Yeah.
1800 is definitely a great milestone. But I'm
Yeah.
sure in this journey, you must have heard some misconceptions that people used to have about
Hmm.
healthy eating.
Hmm.
So, can you just share some of those and what you have faced during your journey?
Okay, so this is a good question. The biggest trap is that people believe one size fits all approach. They think that because it's the going on trend, people are following keto, intermittent fasting, they feel that it will work for them also. But see, nutrition is bio individual. What works for one may not work for another person. Okay. Another hurdle is the low fat or diet label nowadays that this is low fat food, this is healthy food. But what actually happens is this processed healthy food, it is stripped of all natural nutrients and it is made up of preservatives, artificial sweeteners, which actually trigger the inflammation that we are trying to prevent or avoid in our clients. Now, this is the
Okay.
misconception.
Okay. And if I may ask you, which three dietary changes do you suggest and you consider more effective in the way preventive nutrition should be handled these days?
Hmm. So, I believe first prioritize your protein and fiber. Start your meal with a salad or vegetables to blunt the glucose spike. And then you move on to your protein, which will stabilize insulin. And this is the key to preventing metabolic diseases. Secondly, eliminate ultra processed food. Check the labels, read the labels. If anything comes with a long label, long list of chemical additives, then that should be eliminated from your diet. And lastly, take care of the feeding window. Don't just keep eating the whole day. Give your body some 12 to 14 hours of digestive rest overnight so that it can, allow cellular repair. So these
Okay.
three things we should take care of.
Great. So, my next question will be somehow related to this. Since you're
Hmm.
recommending these changes,
Hmm.
how an individual's age or previous medications influence these?
It is everything basically. See, if we compare a 30-year-old professional who has a sedentary lifestyle, his metabolic engine would be totally different from, say, a 55-year-old female who is entering menopause. So we look
Correct.
at the medical markers like what is your thyroid function, how is your gut permeability, your blood sugar levels to tailor the plan. You cannot run a high performance vehicle on the wrong fuel.
Right.
We match your fuel to your unique biological needs. So it's like one shoe will not fit everyone, it's different for everyone.
Okay, so everybody needs to have their personalized plan.
Personalized plan according to your medical condition, your routine, lifestyle, what is your native food, and that all will affect your dietary choices also.
Yeah, I guess this is a very important point because nowadays we watch a YouTube video and we consider
Mm,
it to follow,
yeah,
that anybody can follow it, just like anybody
yes,
can dance, it's like anybody can follow the
yeah,
diet. So
that's
this
true, that's
happens.
true.
Maybe this is a very
Yes,
important point to be considered, that every
yeah,
person, every individual has their unique properties. So their dietary changes are going to be personalized according to their
personalized.
health. Right.
Yes, that's true.
Correct. And can you share some real life examples where simple dietary interventions have, led to noticeable improvements in preventive diet?
Oh, yes, we see this every day. Like, I'll give you an example. Recently, we had a client and he was heading towards type 2 diabetes with very high HbA1c levels. So, by simply adjusting their meal timings, adding more protein and fiber to their diet, we were able to bring the HbA1c levels to a normal range within 4 months. And no medication was required. So he was not a diabetic, he was a pre-diabetic client. So it's success stories like these which help us get 280 plus 5-star Google reviews. So it proves that when you give time to the body, when you give it the right tools, it is able to heal itself.
Correct.
Yeah.
And more on that, if I ask, the current trend is totally of junk food, processed food. Like if you
Mm-hmm.
ask me, some days I guess I feel like I don't want to cook, I can order something online.
Yeah,
So
that's
now
true.
with this growing trend of all processed and fast foods, what
Mm-hmm.
practical tips can you suggest, especially for busy professionals? It is very hard for them to maintain a preventive diet. So what do
Yes,
you
yes,
suggest for them?
yes. See, the easiest thing is meal preparation. Just give 10 minutes a day to your meal prep. If you are going to plan one day before what you are going to have the next day, it will prevent you from reaching for that packet of chips or cookies. You know that yes, tomorrow breakfast I'm going to have this, tomorrow lunch I'm going to make this. So if it is prepared, if it is planned, you are less likely to fall in the trap of going for junk food. Secondly, what you can do is, I agree that we are busy professionals. We are not able to cook every day. Maybe you have a business lunch. So try to fill up your plate instead of filling it with lots of rajma and rice or only carbs. Try to go for grilled paneer, some grilled protein options if you're a vegetarian paneer, if you're a non-vegetarian chicken. So try that when you're eating out. And thirdly, this is the time when most of us have that, binge eating wala craving 4 to 5 p.m. So that should
Correct.
be your rescue attack should your rescue snack should be ready. Have a say a small box of seeds ready or dry fruits, makhanas, roasted chana. Some healthy snacks should be handy so that you don't reach for any
Hmm.
cookies or biscuits at that time, as usually happens with everyone.
Correct.
Yeah.
True. I guess I have to start implementing something like that.
Sure.
Yes, but since we are talking about balance right now,
Mm-hmm.
balance in our plate, how important is the balance of macronutrients like proteins, fats, carbohydrates versus micronutrients, for example,
Mm-hmm.
vitamins and minerals in preventive health?
Yeah. So this is good. We already know what macro and micronutrients are. So this makes it easy for me. See, macronutrients is what you need in a large amount. So think of it
Mhm.
as the fuel in your car. Okay.
Okay,
Micronutrients are equally important, but they are needed in small quantity. So you can take it as the spark plug in your car. So even if you have a full tank of gas, but if your spark plug is not working, the car is not going to move. So for long-term prevention, these both will go hand in hand. We need high nutrient density so that actual cellular repair can start. So it should be a nutrient diet, it should be a nutrient dense diet, right mix of both macro and micronutrients.
that's quite informative. So,
Thank you.
moving ahead, we have also seen today many people rely on supplements. And
Mhm.
if I may ask, in your view, can a well-planned diet alone meet preventive health needs, or are supplements necessary today?
See, I believe in a food first approach. In an ideal world, our food should be enough to meet all the nutrient requirements. But with modern soil depletion, high stress levels, then you know what you should do a yearly blood test And then
Mhm.
you should have a look. If you feel that there are certain gaps in your nutrition, then supplements are required to bridge that nutritional gap. But it can't be a substitute for a balanced diet. So ideally, have a proper balanced diet and then get your blood test done. If you feel that there is some nutrient deficiency, then those supplements should be there to fill in that nutritional gap, not as a substitute for your real food.
Okay. But
Yeah.
still, supplements are not necessary, or you can just add it.
No, they are not
Okay.
necessary. If you are having a properly balanced, nutritious diet, then 99% of your nutritional requirements, you can fill with the diet. So I believe in
Okay.
food first.
That's amazing because we rely
Yeah.
so much on supplements.
Yeah.
If we have this vitamin D deficiency, let's go and
Yes.
take the injections instead of
Yes.
preferring
So let
something
a
natural.
physician decide that. No, you have your proper balanced diet. Get your blood
Okay.
test done. If the levels are too low, then obviously a physician is
Mm.
going to give you the supplement. But doesn't mean
Okay.
that yes, I'm having supplements every month or I'm having injections for vitamin D every month, so I'll stop sitting in the sun. That should not be the case.
Got it. It should be balanced
Yeah,
here as well.
it should be balanced. Yes.
Right. So, what message you want to share it with someone who wants to start their preventive health journey right
Mhm.
from their plate today? So, what do you suggest, and what message do you have for them?
I'll just say that don't wait for a symptom to become a diagnosis.
Mm.
Your body is communicating with you every day in the form of your energy levels, your gut, your skin, your digestion, everything. So start by making one better choice at the next meal only. That yes, next meal I'm going to have a balanced diet. And at Eat Well Thrive Better, we believe that you are just one plate away from a totally different quality of life.
Okay.
Yeah.
Very nice. So, yes, if you want to add something to this, to the entire interview, those were the questions were from my end. But if you have anything, something to add that might have been missed from our end.
I think we covered everything.
Okay. Okay,
Yeah.
Dr. Mathur, it was lovely talking to you. Very detailed information, though the interview was very short, but the details were very quick. I mean, to the point for anyone who wants to start their journey today. I guess this interview will be a very descriptive way of telling them these are the key points that you have to follow. You don't have
Exactly.
to go through the entire YouTube video because personalization is very important. And
Yes.
I'm sure Eat Well Thrive Better is doing a very great job. So thank you for the detailed insights, and we wish you and your company a great journey ahead from Insights
Thank you
Care.
so much. It was my pleasure. Thank you for having me.
Thank you. Yeah.